All right, the pandemic has certainly taken its toll on the mental health of many people, including our kids.
Local emergency rooms are seeing higher rates of youth with suicidal thoughts and attempts. So what can we do? Dr.
Laura Santos is joining us now. She's a psychologist at the Institute of Living, and she's here to talk more about this pretty serious subject that we have to pay attention to. Hi, doctor.
Hello, Kara and Scott. Yes, this is a serious topic this week because we are seeing higher rates of youth struggling with very severe depression and suicide attempts. So we need to talk about this topic, even though it's uncomfortable for people.
Well, and you say to talk about it too, right? And bring it up. It doesn't put in their heads the fact that just by talking about it, they're not going to go commit suicide.
Right. It's a myth that just talking about suicide puts the idea in people's heads. It, in fact, is already there. So the other statistic that I've been talking about a lot is that 13.5% of youth, so that's 1 in 7 youth, seriously consider attempting suicide. So there's a lot of kids out there who are struggling. And the bigger issue as we come out of the fall is that pandemic depression will collide with seasonal depression. So, we just have to be very wary and very careful.
Well, especially it is the second leading cause of death, and you say that generally firearms are the most common. So these are really serious, scary things. What are some actionable things that parents can be doing to prevent suicide, or even just to make sure our kids can get their moods on up?
So what we talk about all the time with parents of young people is to reduce access to lethal means. Lock up your firearms and lock up your medications. Let's take away access to things that if you do have an impulse or disinhibited in some way and might act on your thought of harming yourself, let's take away access to lethal means. Lock up your meds, lock up your firearms.
And let's talk about, are there risk factors that we can look for, like signs that we could be seeing in our children? How do we know that they're journeying down this rabbit hole?
Well, what we see, the general depression risk factors are isolation, losing interest in things. But see, those are things that are kind of common right now to the pandemic anyway. Not doing things that you previously would enjoy. Additional risk factors are use of substances, because when you're disinhibited, you're actually more likely to attempt something. Being LGBTQ, in fact, is a risk factor, and there's a lot of those issues that are more common right now during COVID. And also any kind of previous history of mental health issues or any kind of vulnerabilities, mental health vulnerabilities, we need to really look out for those kids and teens.
Sadly, we know someone who just lost someone to suicide, and the family really thought, oh, we didn't think he'd ever do it. And you hear that so often when we interview people who are survivors of someone with suicide. So what do you suggest parents do if they even have an inkling, or what's a resource they should act on immediately?
So there are some really good resources out there. 211's a resource. The Hartford Healthcare Community Care Line's a good resource. And I provided some of those resources to you. I think what we need to do on the interpersonal level is to talk about it. We need to bring this up. We need to not be afraid to bring up these topics. They're very uncomfortable to talk about, but the more we talk about them, the better it is for our children to know that you're a safe person to talk about. We don't have as much access to school resource folks that we used to have in the past. Because I think pediatricians or school resource folks are also really good, but we really need to bring this up to our kids.
All right. Well, thank you so much. We so appreciate it. A good conversation we just had about the topic. Don't be afraid to bring it up, right?
Yeah.
Don't be afraid to bring it up.
Make sure to ask those tough questions. Thank you, Dr. Laura. And again, 211 is a great thing to do. You can also text HOME to 741-741, but there's some great resources out there. Don't